Where. Eh. And now you see the importance of DNA.
If I have an identical twin brother and my identical twin brother gets my wife pregnant and we do a DNA test, is it possible to tell whether the child is mine or not?
We say that science, when it's done perfectly, it's 100% sure. And that's why it's always encouraged that when DNA testing is done, ideally we should want to test both the father and the mother. And at Cerba, Lancet, Kenya, the mother has to give the consent. It's not possible for an individual to carry DNA from another party that was not involved at the time of conception.
Welcome back to Family Unscripted. Today we'll be talking about DNA paternity testing. And in the house we have Dr. Charles Ngari from Cerba, Lancet, Kenya. Dr. Charles Ngari is a consultant pathologist and head of clinical pathology services, Cerba, Lancet, Kenya. Now, we want him to speak from a professional perspective about DNA. So we will, now that I've introduced him, maybe we'll hand over to him so that he can take it over.
Thank you very much. Welcome to this Family Unscripted show, where we'll be discussing DNA testing with focus on paternity testing. And we shall have a session where we shall be looking to introduce this test scientifically, demystify some myths, and just have very balanced and fair discussions around this test. Thank you.
Now, Doc, what is paternity testing or paternity DNA testing?
Okay, thank you. So in terms of DNA testing, so generally there are different types of DNA testing, different methods, but in terms of establishing whether one is related to an individual, we have two main tests. So we could have paternity testing, and within that we also include maternity testing, whereby we establish that two individuals are related biologically to a child through parentage. We could also have kinship testing, whereby we just want to see how related are two individuals. Are they related as first-line siblings? Are they related as cousins? Are they related as uncle and aunt? So that's generally how we look at it.
Oh, so like those who claim to be from this family and this other family, for example.
Yes, it's possible to establish whether two or more individuals are related through DNA, and that is what is undertaken when we do DNA testing.
Ah, nice. Now, in comparison, when you do it this, now that is a scientific way. Are there instances where science meets tradition?
Interesting question. Well, we say that science, when it's done perfectly, it's 100% sure. But of course, we know that when it comes to tradition, we want to see similarities. Yes. When you look at a child and you look at the parents, you do see striking similarities. And so that's one aspect that we say this child is likely belonging to this parent, but it's not 100% sure. That's where science comes in.
Are there instances, for example, where mtoto ameletwa, from your perspective, wanafanana masikio, mapua, meno, the smile, then ukifanya test unapata iko negative? Are there such cases you've ever witnessed?
Yes, of course. So, of course, there could be chances that the person who, let's say, is the biological father of a child could be related to the person who could be tested.
Ah, like the brother? I'm getting this thing.
That's a possibility. And in which case, we do get a negative paternity test. However, there could be other instances where you find possibly that the child does not belong to the father and does not belong to the mother.
Wait. And now you see the importance of DNA. Unaona? Shtuka kidogo.
How can this child not belong to both the father and the mother?
So in very rare circumstances, we have a occurrence where we call switched at birth, whereby a child is born and for a very brief moment could be mixed with other babies at the hospital. And by the time the baby is being delivered to the parents, one or two occurrences could have happened that made a switch of the children occur. And so parents actually could end up going home with a child that is not theirs.
Wow. So in the event that you get to that point, huyu mtoto anaendanga wapi?
Well, in such a phenomenon, if at all they come to do the testing, we'll be able to test. And that's why it's always encouraged that when DNA testing is done, ideally we should want to test both the father and the mother.
Oh, so nisiibe tu sample nikulete?
No, if
I've been planning. Ndio hata nilikuwa nataka kukuuliza hapo nyuma ya tent what I need to collect. Unajua that conversation between the wife and the husband to agree na kuanga ngumu sana. So now
well, ethically speaking, it's wrong to test a child, whereby you test the father and the child alone without the mother being informed that this is happening. And at Cerba, Lancet, Kenya, the mother has to give the consent. In absence of the consent, then we would want a court to be involved.
Yeah, nice.
Go ahead.
The court has come in to help. So, because in most cases, the ladies find it very hard when they know that wamekuwa kizunguka hivi na hivi, they don't give consent.
Well, we also want to protect the rights of the child. So the rights of the child are enshrined in the Constitution under the care of both the parents.
Okay. So now,
Wanted to ask, is DNA test is DNA testing expensive?
In terms of the cost?
Yes, in terms of the cost.
So the procedure is that when the two parties agree to come for the test, or if the court orders that the test be done, what happens is they present themselves to the laboratory and we collect a blood sample, and this is what has the highest DNA yield. So once the sample has been collected, the parties pay 20,000 per individual tested. And the individual who has to be tested is the child, of course, and the alleged father at a minimum. But as we've gone across or we've discussed, that it's always good to test the mother. So that would be a total of 60,000 when the three are tested.
What type of sample does Cerba, Lancet, Kenya need to collect for a paternity test?
Okay, so different samples can be collected for DNA testing in general. So we can have blood tests. So blood gives the highest yield of DNA. Blood is not contaminated, so the DNA that is obtained is very pure. And blood can be kept for a longer time than other samples. Other samples that could be collected include cheek swabs right to the inside of the cheek or the hair. But for the hair, you have to be careful to pluck the roots of the hair, not just the top part. You have to pluck the roots.
So that is done at your place, not at home, eh?
So for the blood test, it has to be done at the laboratory.
And the hair?
So the hair we do not accept because we do not know.
Yeah. Umeharibu mpango yangu. I have a hair sample somewhere. So hiyo hapana.
Hair, no. Cheek swab, no. We cannot verify the identity of that. So when we collect the sample, we also verify the individuals. So the child will be verified the identity through the birth certificate or a birth notification. And when it comes to the parties, the alleged father and the mother, we identify them through either the national ID, the passport, or any other valid document issued by the government.
Okay. Now, what are the steps? Let's say now, me, Gilbert, I've been wanting to know the status of these kids of mine for a long time. Now, what do I do apart from the charges? What is the procedure? I've come to you now, Dr. Charles, Apale Lancet. How do I start?
Okay, so you ideally make a booking whereby you can call the lab, tell them the day you want to come in for the test so that when the lab prepares, if there are witnesses who want to come in, you could also agree to come in with them.
You allow witnesses?
Oh, yes.
They come sit while the test tube is changing or what?
No.
Or moral support?
So for example,
yes.
Just for examples, some of these DNA tests are conducted out of divorce proceedings, and the lawyers are called in to witness as part of the whole process, so that even when the case moves to court, there are no doubts as to what the results are. Then once the parties come in, and we do the due identification of who is to be tested, we collect the blood sample and process it and send it to the laboratory for testing. So once the results are out, we notify the parties that the results are out, and we call them to come and pick the results. The results are never issued when one of the parties is not there. Both have to be there.
Both have to be there.
Both have to be there. And the report cannot be sent out electronically.
Hakuna hii WhatsApp nini hiyo?
No.
Okay.
So that way, the parties receive the reports and are able to acknowledge that each of them have gotten the report that the other party has, so that there can be no accusation that a report has been doctored.
Now, how long does it take for you to get these results?
So it takes roughly 3 to 4 weeks to get the results, and mainly this is because of it's quite technical to do the analysis. There are various steps of verification from various staff members at different levels of expertise, and then now also it requires some steps when it comes. Once the results are out, we need a sign-off from people who are higher up in the testing process, because this is still, or this could end up being a legal matter.
So is Cerba Lancet Kenya paternity test results legally admissible?
Yes, so there are two main ways in which we get involved when it comes to the court process. So there could be the court coming in from the word go, whereby the court issues an order and instructs that paternity testing be done. So in such a case, once the results are out, the results go directly to the court, not to the parties first. So it is at the discretion of the court to disclose the results to the parties and could give them a copy or order that the parties go back to the lab and pick their own copy once the court has said that this is ready. Alternatively, once the results are out and the parties are picked, they can go now to the court and say, we had this matter, we've done the DNA test, we have the results, and this is how we'd like to proceed with the matter.
Okay. Now, since this is a very sensitive issue, especially for the ladies, now, do you have counselors before and after when you're doing this process?
So yes, we do give some counseling. That is before we carry out the test. We explain to the parties what it is that we want to do. We explain to them the expected outcomes. And once the results are out, once the outcome is determined, we call them in, explain to them what the result is, and we give them some counseling on it, what it means, if it has to involve the court, how it is we shall engage the court, plus any other support that they would want, we can either offer or we organize for it to be given.
So now that you know it's a touchy issue, if the results don't come the way of the lady, what usually happens?
Well, the way of the lady could be either way. So, assuming that
armed guards,
so assuming that the way of the lady is that she wanted the DNA to confirm that this man is the father, and it ends up not being the father. So we always have a sit down with both the parties and explain to them what the legal implications are, what the social implications are, so that now, even as they are leaving the facility, they are much more informed. It's not just the scientific result. There is a social aspect to it, because as per the requirements of the law, a child still has to be cared for.
That's very good. Now, I see the lady is very happy, eh? But now, what is chain of custody?
So, chain of custody is whereby we look at the events that are taken to ensure that the sample that is collected from an individual up to the point of testing and release of the results, that whole process has been monitored. There is documentation of that monitoring, and that when the result is out, that it actually truly belongs to an individual. So that now, if in case there's any doubt as to whether this is the true result, there's evidence documented at each step that this indeed is the true result.
Allow me ask this. Is it possible that the results can be doctored in this sense if can one party influence the outcome of those results?
Okay, I'll speak for my organization and say no, it's not possible. So there are unique ways we assign each sample. there's a special number that we give to the sample, and that number moves through the system all the way to the lab, and once the result is out. And so the unique number cannot be tampered with. Once you tamper with the process anywhere along the process of testing, that result is declared invalid. We call in the parties, explain to them what could have gone wrong, and we restart the process afresh.
Now, tell me, what are the accuracy rates of this DNA testing? If it says negative or it says positive, what confidence level should we be giving it?
Okay, so based on the science, the DNA testing is 100% accurate because we are taking or we are analyzing DNA that comes from a mother and a father. We know that this DNA can only be inherited from the mother and the father and not anyone else. So when the process is done correctly, once the result is out, it's 100% accurate, whether it confirms paternity or excludes paternity.
Now, there's this issue of it's called chimerism. I don't know whether I've mentioned it properly, where they keep saying that one child can have the DNA of the ex-husband, the ex-lover. That every time someone gets in there, anawacha ka DNA. Then mwingine pia anakuja anawacha ka strand. So by the end, you have a concoction of DNAs. Is it true? Is it false? Tell us, Doc.
So it's not possible for an individual to carry DNA from another party that was not involved at the time of conception.
Oh.
So chimerism does not happen in that way.
So unasema ni jaba.
Yes, so only one person can give the male pattern of DNA, and one person gives the maternal part of the DNA. No one else, no matter how many
partners before
involved previously. When it comes to the conception, only one.
Only one lucky guy.
Yes, gives a set of DNA.
And there's also this thing where they say, unaona, when you start living with your wife, you anakula hii DNA yako kila siku, mnaanza kufanana. Is it true that the DNA can alter the outlook of someone? Is that scientific?
No, that's not scientific.
Why do people who live together start looking alike?
No, I think it's
including children that are not yours.
Well, I think it's more perception that when people have been spotted together for so many years, you can't picture one person without the other being in the picture. So even for children, once people have formed a family unit and you see them growing up and, moving ahead with life, with time, then you just cannot associate these people differently other than that setup.
Now, data that I cannot verify says that I think I think it's Zambia. They did some government-sponsored DNA, and out of the tests that they did, 60% of them came out negative. Maybe you've heard, and I think there's also another country, I think it's Ghana, who also from the government analysis of the cases that came before them, they found that 60% of the men who underwent that DNA test were not fathers of those children. So I don't want to ask you about Kenya, or maybe I can ask you about Kenya when I thought Lancet, but what does that speak? Is it that the DNA is wrong? Is it that the sampling by the time you're getting there is wrong? Tell us.
Okay, well, I'm not too familiar with those cases, but I'll just speak generally that when it comes to studies, sometimes studies select who are the participants, such that now they might not have included, for example, married couples, say for example, so that now there's what we call selection bias when it comes to scientific studies. So if there was a selection bias, then you could end up with results that look skewed, and you cannot push that to the general population. Such that now, if you're to do testing without any selection bias, you do what you call a random sample, or random sampling, whereby you pick people at random and you do the test. And I believe when it comes to most institutional marriage institutions, I believe that indeed children do belong to the partners who are married.
Hey, amecheka, amefurahi. We'll still have to verify. Now, there's, I think there was a bill that was being fronted in Kenya. I know it's a similar bill to other African countries where they are saying DNA should be done at birth. What do you think about it?
Well, if that could be the reason, if that could be the bill that is being passed, ideally there should be a scientific basis for that. So say, for example, you want to find out what is, in terms of some diseases that are carried within families, you don't want to find out why, or you don't want to establish such a reason for doing the DNA testing, such that it's not just paternity and maternity testing. You don't want to go deeper and find out what are the diseases which could come in when we do some of these DNA tests.
Oh, okay. Now, which other question? Now, in terms of DNA or testing prior to marriage, are there tests, for example, that are undertaken by couples before they get married at Lancet?
Well, it does happen, though it's not a standard. It's the government has not asked that couples be tested before marriage, but we do get some couples coming in to test for some known diseases, so that now they see whether either they will proceed to get married, or even when they get married, they are prepared for certain outcomes. Good example is, for example, a disease you've heard of, sickle cell disease, whereby some couples actually do come and say, we want to know our risk, so that they know if there's a chance that they'll have children born who might have the sickle cell gene.
So are they common tests that people undertake, or what is the popularity of the same?
Oh yes, it's a common test. So it doesn't have to be a DNA test. Some tests can be done whereby we are able to just, without looking into the DNA, we are able to tell whether some people are either carriers or suffer some of these diseases. But when it comes to the DNA tests, we do have some people coming in to test for some rare diseases, which they would want to know, as a couple, are we at risk of getting a child who has a rare disease?
Now, we have the audience with us. Is there anybody who has a question for Doc in regards to DNA testing? Sisi wote tuko sawa na watoto wetu.
So good evening, everyone. So Daktari, I had a question. If it's a myth in Meskia, if I have an identical twin brother and my identical twin brother gets my wife pregnant and we do a DNA test, is it possible to tell whether the child is mine or not?
Okay, thank you. That's a very brilliant question. A difficult question to answer because the truth is that identical twins, and identical meaning that even when you look at them, they you can't tell them apart, share the same DNA. Because what happened as soon as conception happened, we have an embryo, and the embryo split into two. And the DNA or the genetic material in that embryo is exactly the same. So we do expect that identical twins have the same DNA.
Remember, you have twins, eh? Yeah, it's hitting or closer home. Now, just before we wind up, there are certain questions I still have. Let me ask before now, or I go back to the plenary. At what week of pregnancy is it possible to take fetal DNA samples?
Usually from early as 10 weeks.
Ah.
Yes, but we prefer taking from 14 weeks onwards.
14 weeks, we are ako ndani ya tumbo?
Yes, when we...
Hey, this will save men. Hey, clarify that point again.
All right. So, from the age of, from the 10th week of pregnancy, the fetus starts shedding DNA that can be detected in the mother's blood. And this DNA is not anything of concern health-wise, but we are able to take that DNA or take the mother's blood, purify, and get the DNA of the baby and test it. So generally we test that DNA for rare diseases so that we know if the couple decide to move ahead with the pregnancy, that they are able to, or they are prepared to deal with the health consequences. But generally we do not take that DNA for testing.
Oh, it's not for
paternity.
It's not for paternity?
No, we don't.
There's this other issue or another way of testing where is it possible to test DNA through the ear?
Sorry, through the ear? Skill?
Yeah, swab.
No, so in the ear there'll be just skin cells, and even if you rub them off, the DNA in the skin cells are it's very little. It could not be extremely pure in terms of, because the ear has a lot of bacteria. Other cells are shedding off, such that now we are not able to get a good sample. So we rarely use samples outside cheek swabs, hair roots, and blood.
So there's also this myth where unapea mtoto glass, akisha kunywa unaweka ndani ya bag. Unapeleka Lancet. Can that one help?
No, that's also a myth. So the DNA that is collected, we should be able, as a lab, to ascertain that for sure this is the person's DNA who we've collected. So that now, even when we are giving out results. You can imagine if a lady if a lady receives results from her partner saying that I took the child and the child is not mine, she will obviously dispute those results and say, when and where did you
How?
that sample and how?
Now, there's also this issue. Now, let's say you've done the paternity test. Do you allow for second and third opinions?
Okay, so yes, we do. So just like any process whereby we have either input of human expertise or input of even machines that may have some deficiencies, the process of testing is not immune to some flaws in the system, such that you get results once in a while that need to be confirmed. That's why sometimes it takes up to 4 weeks, because we are really verifying. But that process is not 100% flawless. We do get what we call laboratory errors. It's an accepted phenomenon worldwide. And so once in a while, we do have to, despite the best standards being applied, we do have to tell parties that if this is in doubt, you can always go to another facility to confirm. So that now, a lot of times, people do come to Cerba Lancet, Kenya, to do the confirmation. They've gotten a result elsewhere. One of the parties is not happy with it, and so they come for a second opinion in our facility.
Second and almost final.
Well, even third and fourth is accepted, and it's until the parties agree that, okay, fine, we've done this test and we do agree that now this result is the true picture.
So there are cases where I've come to Cerba Lancet, I do the tests, it comes out negative. The mother says, no, we do it again and again.
So ideally, if a second opinion is being sought, preferably it's to be done at another facility, so that now it improves the science behind it. That you want that when a test is done at one facility, the same test being repeated in another facility should give the same result. That is science now.
Now that is real science. Now we are very grateful for you having taken your time to come to teach us about paternity DNA testing. Maybe if there is any final question from the plenary, anybody? If there is none, now what we will do, we just want to thank Cerba Lancet Kenya once again, led by Dr. Charles Ngari, for having sponsored this event and this show. We are very grateful for the expert opinion that they have provided, and we hope that this will be able to educate the masses. Maybe, Charles, you can give us a final word. Dr. Charles.
Thank you very much, Gilbert and Dorothy, for the invitation. It's something that we look forward to engaging various platforms and just letting people know what is available, so that they are not just paternity testing, various tests, so that they know that they are not limited in terms of their health, that they can know in terms of their health and other medical aspects, that they have a partner in Cerba Lancet, Kenya. Thank you.
Thank you very much.